Hurricanes and natural disasters are unpredictable and can affect many aspects of people's lives. Patients with autoimmune diseases and arthritis are no exception. We wanted to give a few tips to you in preparing for a storm and managing a storm if you're living with arthritis and autoimmune disease. If a storm is coming to your area, what do you need to do to prepare in thinking about your medications and your underlying autoimmune condition? First, have a list of all of the medications and the doses for those that you're taking right now. Have a list of your medical allergies and your other medical problems so that you can have these for ready reference in the event that you need to communicate this information to someone else. If you're taking a biological medication by injection or infusion, it's very important for you to have the number for the patient access lines for these compounds. You can find these on the websites for the drugs by their individual names. These websites can help to direct you in the event you have trouble accessing your medication, if you're displaced and have to have the medication rerouted, or providing you with other tips in terms of helping you receive these medications in the event that you are displaced. It can also be very important for you to have the number of your regular pharmacy or your specialty pharmacy that might send your medications to you. This is important in case you get dislocated and have to have those medications sent to you at a different location. If possible, and you have enough advance notice before you are evacuated from an area, speak to your pharmacist or to the mail order pharmacy and see if they can send you enough medication to cover you through the period of time that you expect to be away. If you are taking a biological medication that you give by injection, it's very important for you to travel with this medication on ice or with an ice pack. Most of these medications are not stable outside of the refrigerated environment. If your medication gets warm and cannot be refrigerated, do not take the medication. Assume that it is not stable for use. In this circumstance, you should contact the patient access line or the specialty pharmacy for additional advice on what to do. If you have to relocate for a period of time and can't get to your normal rheumatologist, you can contact the American College of Rheumatology or the Arthritis Foundation to locate rheumatologists in the area where you are going. Recognize that rheumatologists' own practices may be very busy, but we hope that they would be able to accommodate you in these special circumstances. If you're in a new location and have questions concerning your medical condition, especially worsening or flaring of your underlying autoimmune disease, you should seek medical attention. We recognize that the rheumatologist may not be available, and your own rheumatologist may also be displaced and not be able to answer questions for you. If you're concerned about an infection or a severe flare of your disease, you should be seen in an urgent care or emergency setting. It's important to recognize that those doctors may not be familiar with your underlying condition or with the medications that you take. It's very important for you to have a list of these medications and to have a list of your other medical conditions so that they can provide you with the best possible care. We hope that these tips will be of use for you as you prepare for or have to move away due to a storm or other natural disaster. Additional resources can be found through our website. These include phone numbers for medication patient access lines and other helpful tips regarding management of your underlying condition and the medications that you're taking. Thank you.